If you're over 60 and you find yourself waking up 3, 4, even 5 times every night to urinate, if you feel like your bladder never truly empties, if that constant urge to go is controlling your daily life and stealing your peace of mind, you're not alone. Millions of men face this reality, and most believe it's just something they have to live with. But what if I told you that 5 simple daily habits, when done correctly and consistently, can calm an enlarged prostate faster than you ever imagined possible? I'm Dr. Linda Parker, wellness and longevity advocate, and today I'm going to share the exact protocol that has transformed the lives of countless men over 60, giving them back their nights, their confidence, and their freedom. Let me be direct with you. An enlarged prostate, medically called benign prostatic hyperplasia, affects nearly 90% of men by age 85. Your prostate sits right below your bladder, wrapped around the urethra, the tube that carries urine out of your body. As it grows larger with age, it squeezes that tube, making urination difficult, incomplete, and frustratingly frequent. The conventional approach is medication with side effects, or eventually surgery. But there's another path, one that works with your body's natural healing capacity rather than against it. The habits I'm about to reveal aren't random tips pulled from the internet. They're based on decades of urological research, clinical observations, and the real-world results of men who refuse to accept disrupted sleep and constant bathroom trips as their new normal. Each habit targets a specific aspect of prostate inflammation and urinary function. And when combined, they create a synergistic effect that can produce noticeable improvements in as little as 7 to 10 days. Let's start with the first habit, and this one alone can change everything: strategic hydration timing. Most men with prostate issues make a critical mistake. They either drink too little water out of fear of needing the bathroom, or they drink normally throughout the day without any timing strategy. Both approaches worsen your symptoms. Here's what actually works. Drink the majority of your daily water intake before 4 in the afternoon. Aim for 6 to 8 glasses, but consume them strategically between morning and early afternoon. This ensures your body stays properly hydrated, which paradoxically helps your bladder function better and prevents urine from becoming concentrated and irritating. Concentrated urine inflames the bladder and prostate, making urgency worse. Then, after 4 p.m., dramatically reduce your fluid intake. Have small sips only when truly thirsty, avoid large glasses of water, and completely eliminate beverages that act as diuretics. Coffee, black tea, alcohol, and sodas all force your kidneys to produce more urine and irritate your bladder lining. That innocent cup of coffee after dinner, or that glass of wine with your evening meal, could be the reason you're up 4 times before sunrise. The key detail most men miss is this: stop all liquids at least 2 hours before bed, ideally 3. Your bladder needs time to process and empty whatever fluid remains in your system. If you drink a glass of water at 9 p.m. and go to bed at 10, that water will hit your bladder around midnight, guaranteeing disrupted sleep. But if you stop drinking at 7 p.m., your bladder has processed most of it before you even lie down. I've seen men who changed nothing else but their hydration timing report, going from 5 nighttime bathroom trips down to 1 or 2 within the first week. It sounds almost too simple, but your prostate and bladder are extremely sensitive to fluid volume and timing. Work with that sensitivity instead of fighting it. Now, the second habit is something most doctors won't tell you because it challenges conventional dietary advice. Eliminate inflammatory foods completely, especially those hiding in plain sight. Your prostate is surrounded by tissue rich in immune cells. When you eat foods that trigger inflammation throughout your body, those immune cells around your prostate activate, causing swelling, increased pressure on the urethra, and worsening urinary symptoms. The worst offenders for prostate inflammation are refined sugars and processed carbohydrates. That morning pastry, the white bread sandwich at lunch, the pasta dinner, the late-night cookies. Each one spikes your blood sugar, triggering an inflammatory cascade that directly affects your prostate. Studies show that men who consume high amounts of refined carbohydrates have significantly larger prostates and worse urinary symptoms compared to those who avoid them. Dairy products are another hidden trigger for many men over 60. As we age, our ability to digest lactose decreases, and dairy proteins can trigger low-grade inflammation. This doesn't mean you'll feel sick immediately after drinking milk, but over days and weeks, dairy consumption keeps your prostate inflamed and swollen. Many men experience dramatic symptom improvement within 2 weeks of eliminating milk, cheese, yogurt, and ice cream. Spicy foods and hot peppers, while healthy in some contexts, directly irritate the bladder and prostate in sensitive individuals. That burning sensation you feel going in often translates to irritation coming out, and your prostate pays the price. If you notice worse symptoms after spicy meals, that's your body giving you clear feedback. Instead, focus your diet on anti-inflammatory powerhouses. Wild-caught fatty fish like salmon and sardines provide omega-3 fatty acids that actively reduce prostate inflammation. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that help regulate hormones affecting prostate size. Tomatoes, especially cooked tomatoes, are rich in lycopene, a nutrient specifically linked to prostate health. Pumpkin seeds provide zinc and healthy fats that support normal prostate function. One man I guided, Robert, age 67, was scheduled for prostate surgery within 3 months. He committed fully to eliminating inflammatory foods and focusing on anti-inflammatory nutrition. 8 weeks later, his urinary flow had improved so dramatically that his urologist postponed the surgery indefinitely. His prostate was still enlarged on imaging, but it was no longer inflamed and angry, no longer choking off his urethra. The third habit might surprise you because it seems unrelated to your prostate, but it's absolutely crucial. Daily deep breathing exercises focus specifically on pelvic relaxation. Your pelvic floor muscles, the ones that control urination and support your bladder and prostate, are directly connected to your stress response. When you're anxious, stressed, or tense, these muscles tighten unconsciously, squeezing your prostate and making urination more difficult. Most men over 60 carry chronic tension in their pelvic floor without even realizing it. Years of stress, poor posture, and lack of body awareness create a constantly contracted pelvic region. This chronic tension doesn't just make urination harder, it actually contributes to prostate inflammation by restricting blood flow and lymphatic drainage in the area. Here's the specific technique that works. Sit comfortably in a chair with your feet flat on the floor. Close your eyes and bring your attention to your pelvic region, the area between your pubic bone and tailbone. Take a slow, deep breath in through your nose for a count of 4. And as you inhale, consciously relax your pelvic floor muscles. Imagine them softening, releasing, dropping downward. Hold that breath gently for 2 counts, maintaining the relaxation. Then exhale slowly through your mouth for 6 counts, allowing your pelvic floor to relax even deeper. As you breathe out, imagine any tension, any tightness in that area melting away completely. Repeat this cycle for 5 minutes, twice daily. Morning and evening are ideal times. The magic happens when you combine this breathing with a specific mental focus. As you relax your pelvic floor, visualize your prostate shrinking, cooling down, releasing inflammation. This isn't just imagination, it's neuromuscular reprogramming. Your brain controls muscle tension and blood flow through these areas, and conscious visualization combined with breathing creates measurable physiological changes. Within days of practicing this technique, most men notice their urinary stream becoming stronger and more complete. The chronic tension that was squeezing the urethra releases, allowing better flow. The improved blood circulation brings healing nutrients to the prostate and removes inflammatory waste products. And the stress reduction itself lowers inflammatory hormones throughout your body. The fourth habit is movement-based, but not the kind of exercise you might expect. Specific walking patterns that optimize prostate drainage. Walking is excellent for overall health, but most men walk in ways that don't specifically benefit their prostate. By making small adjustments to how you walk, you can turn a simple daily walk into prostate therapy. The key is walking with intentional pelvic movement. As you walk, focus on rotating your pelvis slightly with each step rather than keeping it rigid. Think of your hips as gently swaying side to side like a subtle figure-8 motion. This pelvic rotation creates a gentle massage effect on your prostate, promoting lymphatic drainage and reducing fluid buildup that contributes to swelling. Walk for at least 20 minutes daily, but break it into 2 10-minute sessions if that's more manageable. Morning and late afternoon are optimal because they support your natural circadian rhythm and hormone production. Avoid vigorous walking right before bed as it can stimulate your system and make sleep difficult. Here's a detail that amplifies the benefits. Every 5 minutes during your walk, stop and perform 10 gentle pelvic tilts. Stand with feet hip-width apart and slowly tilt your pelvis forward and backward, engaging your lower abdominal muscles. This movement enhances blood flow specifically to the pelvic region and helps drain any congestion around your prostate. Also crucial is avoiding activities that aggravate your prostate. Long periods of sitting, especially on hard surfaces, put direct pressure on your prostate. Bicycle riding, while great exercise for some, can be devastating for men with prostate issues because the saddle creates constant pressure right on the gland. If you must sit for extended periods, use a cushion with a cutout center that relieves pressure on the perineum, the area between your testicles and anus, where your prostate sits just beneath the surface. The fifth and final habit ties everything together and often produces the fastest noticeable results: thermal contrast therapy applied directly to the pelvic region. Your prostate responds dramatically to temperature changes, and when used strategically, heat and cold can reduce swelling, improve circulation, and calm inflammation remarkably fast. Here's the exact protocol. Every evening, about an hour before bed, sit in a warm bath for 12 to 15 minutes. The water should be comfortably warm, not scalding, reaching at least up to your navel so your entire pelvic region is submerged. This warmth dilates blood vessels, increases circulation to your prostate, relaxes pelvic muscles, and promotes drainage of inflammatory fluids. While in the warm bath, practice the pelvic floor breathing you learned earlier. The combination of heat and conscious relaxation creates a powerful therapeutic effect. After the warm bath, dry off and immediately apply a cold pack wrapped in a thin towel to your lower abdomen, just above your pubic bone, for 3 to 5 minutes. This sudden temperature change causes blood vessels to constrict, then rapidly dilate when you remove the cold, flushing out inflammatory waste products and bringing fresh, oxygen-rich blood to the area. Never apply cold directly to the skin, and never for more than 5 minutes. The goal isn't to freeze the area, but to create a vascular flush. Some men report feeling an immediate sense of relief, a reduction in that constant pressure sensation, right after completing this thermal contrast therapy. For even greater benefit, you can add Epsom salts to your warm bath. The magnesium in Epsom salts absorbs through your skin, helping to relax muscles throughout your pelvic floor and reducing systemic inflammation. Use about 2 cups of Epsom salts in a full bathtub and soak for the full 15 minutes to allow adequate absorption. One important note: if you have heart conditions, diabetes with nerve damage, or any circulation issues, consult your doctor before starting thermal contrast therapy. Temperature extremes affect blood pressure and circulation, and you need to ensure it's safe for your specific situation. Now let me share the story of James, a 72-year-old man who came to me desperate and exhausted. He was waking up 6 to 7 times every night, his urinary stream was weak and intermittent, and he felt a constant pressure in his pelvic region. His urologist had prescribed medication, but the side effects were affecting his intimate life with his wife, and he was considering surgery despite his fears. James committed to these 5 habits religiously. He shifted all his hydration to before 4 p.m., eliminated dairy and refined carbs completely, practiced pelvic breathing twice daily, walked with pelvic rotation every morning and afternoon, and did thermal contrast therapy every single evening. Within 10 days, he was down to 2 nighttime bathroom trips. Within 3 weeks, his urinary stream was noticeably stronger. By 6 weeks, he was sleeping through most nights with just 1 brief wake-up, and his daytime urgency had nearly disappeared. His urologist was stunned at his next checkup. While his prostate was still enlarged on examination, it was significantly softer, less inflamed, and no longer causing severe obstruction. James avoided surgery, stopped his medication under medical supervision, and regained quality of life he thought was gone forever. And he did it with nothing more than these 5 consistent daily habits. Here's what you need to understand about prostate enlargement. The actual size of your prostate matters less than the degree of inflammation and tension around it. You can have a moderately enlarged prostate that causes minimal symptoms if it's calm and relaxed. Or you can have a slightly enlarged prostate that's inflamed and compressed by tense pelvic muscles, causing severe symptoms. These 5 habits target inflammation and tension, which is why they work so effectively even when the prostate itself hasn't dramatically shrunk in size. Let's talk about realistic timelines, because I want you to have appropriate expectations. Within the first week of implementing these habits, most men notice improved sleep with fewer nighttime awakenings. This happens because the hydration timing and thermal therapy have immediate effects on bladder irritation and fluid balance. By week 2 to 3, you'll likely notice stronger urinary flow and better bladder emptying. This results from reduced inflammation, improved pelvic floor relaxation, and better circulation from the walking and breathing exercises. By week 4 to 6, the dietary changes have had time to reduce systemic inflammation significantly, and you'll experience the most dramatic improvements in urgency, frequency, and overall comfort. But here's the critical point. These habits only work if you do them consistently and completely. Doing 3 out of 5 won't give you 60% of the results. It might give you 20% or none at all. These habits work synergistically, each one supporting and amplifying the others. Skipping the dietary changes while doing everything else leaves inflammation active. Doing the diet perfectly, but skipping the pelvic breathing leaves tension restricting your urethra. Commit fully or don't start at all. Half-hearted efforts produce half-hearted results, especially with something as stubborn as an inflamed prostate. Give yourself a solid 6-week trial where you implement all 5 habits daily without exception. Track your symptoms in a simple journal, noting nighttime bathroom trips, daytime urgency, stream strength, and overall comfort. You'll be able to see objective progress, which builds motivation to continue. Now, I need to address something important. These habits are powerful and effective for benign prostatic hyperplasia, the non-cancerous enlargement that affects most men. But they are not a substitute for medical evaluation. If you've never had your prostate checked, if you have blood in your urine, if you experience pain with urination, or if you have a family history of prostate cancer, you must see a urologist for proper screening. These habits can coexist beautifully with medical treatment. If you're on medication for your prostate, continue taking it as prescribed while implementing these habits. Many men find that their symptoms improve so much that their doctor can reduce medication doses or even discontinue them. But that decision must be made by your physician based on objective findings, never on your own. If surgery has been recommended, these habits can potentially delay or even eliminate the need for it, as happened with Robert and James. But some men have prostate so large or complications so severe that surgery is the best option. In those cases, implementing these habits before surgery optimizes your pelvic health, making recovery faster and more complete. Let me give you the complete daily protocol in a simple format you can follow easily. Upon waking, drink a large glass of water and take a 10-minute walk with pelvic rotation and tilts. Have a breakfast rich in anti-inflammatory foods like berries, nuts, and eggs. Mid-morning, practice your 5-minute pelvic breathing session. Continue drinking water freely until 4 p.m., focusing on anti-inflammatory meals throughout the day. After 4 p.m., switch to small sips of water only when needed and completely avoid coffee, tea, alcohol, and carbonated drinks. Early evening, take your second 10-minute pelvic rotation walk. Stop all fluid intake by 7 p.m. if you sleep at 10, adjusting accordingly for your schedule. Around 9 p.m., take your 15-minute warm bath with Epsom salts, practicing pelvic breathing while soaking. Follow immediately with 3 to 5 minutes of cold pack application to lower abdomen. Then prepare for bed with confidence that your night will be more restful than it's been in years. This routine becomes second nature within days. It's not complicated or time-consuming. The total active time investment is about 45 minutes daily, spread throughout the day. For the gift of sleeping through the night, having control over your bladder, and avoiding medication side effects or surgery, 45 minutes is insignificant. I also want to address the emotional and psychological impact of prostate issues because this aspect is often ignored. Constantly needing the bathroom affects your confidence, your willingness to travel, your intimate life, and your overall quality of life. Men tell me they avoid social events, long drives, movies, or visits with grandchildren because they're afraid of embarrassing bathroom urgency. This isolation and anxiety creates a vicious cycle. Stress and anxiety increase muscle tension, which worsens prostate symptoms, which increases anxiety further. By addressing the physical symptoms with these 5 habits, you simultaneously break that psychological cycle. As your symptoms improve, your confidence returns. As your confidence returns, your stress decreases. As your stress decreases, your pelvic floor relaxes more deeply, further improving your symptoms. Many men report that regaining control over their bladder feels like regaining control over their life. They travel again, they engage socially without fear, they sleep peacefully beside their partners without disrupting the night, and they feel like themselves again rather than like a prisoner to their prostate. And let's talk about something many men are too embarrassed to discuss even with their doctors: how prostate issues affect intimate life. An enlarged, inflamed prostate doesn't just cause urinary symptoms. It can affect sensation, comfort during intimacy, and confidence in that area of life. The medications commonly prescribed often worsen these issues, causing problems with desire and function that strain relationships. These 5 natural habits support healthy, intimate function because they reduce inflammation, improve pelvic circulation, and don't interfere with the delicate hormonal and vascular mechanisms involved in male vitality. Many men report that as their prostate calms down, their confidence and function in intimate moments improve as well. It makes perfect sense. A healthier, less inflamed pelvic region functions better in every way. Before we close, I want to give you one bonus strategy that enhances all 5 habits: stress management through daily meditation or quiet reflection. Chronic stress elevates cortisol and other inflammatory hormones that directly worsen prostate swelling. Even 5 minutes of quiet meditation daily separate from your pelvic breathing exercises, can lower these inflammatory markers significantly. Find a quiet space, sit comfortably, close your eyes, and simply observe your breath without controlling it. When thoughts arise, and they will, gently return your focus to your breath. This simple practice reduces the systemic inflammation that feeds your prostate problems and supports all the other habits you're implementing. You might be wondering, can these habits help if you've been dealing with prostate issues for years or even decades? Absolutely. Your body's capacity to heal and reduce inflammation doesn't disappear with age. I've worked with men in their 70s and 80s who experienced profound improvements despite having suffered for many years. The prostate responds to the right interventions regardless of how long it's been problematic. The key is consistency and patience. If you've had severe symptoms for 10 years, don't expect them to vanish in 10 days. But realistic, meaningful improvement within 4 to 6 weeks is absolutely achievable. And continued improvement over months is common as your body's natural anti-inflammatory systems strengthen and your pelvic health optimizes. Let me leave you with this powerful truth. Aging doesn't mean surrendering to uncomfortable symptoms and disrupted sleep. It doesn't mean accepting medication side effects or invasive procedures as inevitable. Your body at 60, 70, or 80 still has remarkable healing capacity when you give it the right tools and stop doing the things that harm it. An enlarged prostate is common, but suffering from it is optional. These 5 daily habits, strategic hydration timing, anti-inflammatory nutrition, pelvic breathing and relaxation, therapeutic walking patterns, and thermal contrast therapy, give you concrete, actionable tools to calm your prostate, improve your symptoms, and reclaim your quality of life. Starting today, you have a clear path forward. No more lying awake at night, wondering when the next bathroom trip will interrupt your rest. No more planning your day around bathroom locations. No more feeling like your prostate controls your life. You're taking back control with knowledge, consistency, and habits that work with your body's natural wisdom. If this information resonated with you, share it with other men who are struggling silently. Most men suffer unnecessarily because they don't know these strategies exist, or they believe nothing can help except medication or surgery. By sharing this knowledge, you're potentially changing someone's life, giving them hope and practical solutions where they saw none before. Remember, your prostate doesn't define your golden years. Your quality of life, your sleep, your freedom to enjoy each day without constant interruption. That's what matters. And with these 5 habits, you have everything you need to achieve exactly that. Here's to peaceful nights, confident days, and a prostate that no longer runs your life. See you in the next video.